Hey cat people, welcome back to the Trends News channel. It's me, and today we're diving deep into a topic that's incredibly close to my heart: the health of our feline family members. Here in the United States, we have millions of cats sharing our homes and our lives, but are we doing everything we can to ensure they're living their best, healthiest lives? It's a question we all need to ask ourselves. Because being a cat guardian isn't just about the cuddles the head boosts. It's a profound responsibility. It's about understanding their world, their needs, and their vulnerabilities. The truth is, many common health issues are preventable, but they often go unnoticed until they become serious. Why? Because cats are masters of disguise. They're hardwired to hide pain and illness, a survival instinct left over from their wild ancestors. This means it's up to us, their guardians, to be vigilant, to be proactive, and to be their number one advocate. We need to learn to read the subtle signs and understand the risks they face every single day, right in the comfort of our own homes. That's exactly what we're going to tackle today. We're breaking down the top 5 most common health problems I see in cats across the country. We'll explore what they are, why they happen, and most importantly, what you can do to prevent them. This isn't about scaring you. It's about empowering you with knowledge. Because a well-informed cat parent is the best defense your cat will ever have. So grab a notebook, get comfortable, and let's get into it. Your cat's health journey starts right now. Alright, let's start with a big one, literally: obesity. This is one of the most significant and rapidly growing health crises for US cats. It might seem cute, but it's incredibly serious. We're loving our cats to death with food. Overweight cats often struggle to groom themselves. Extra weight puts a tremendous strain on almost every organ: heart, lungs, joints. It's a gateway to a host of other problems. The primary cause? Too many calories. And not enough activity. Think about the life of a typical indoor cat. We often free feed, leaving a bowl of dry kibble out 24/7. This goes against their natural instinct to hunt for their food. In the wild, they'd eat multiple small meals and work for each one. Free feeding is like an all-you-can-eat buffet that never closes. So, what's the solution? Think like a cat. First, portion control is non-negotiable. Work with your veterinarian to determine calories based on age, ideal weight, activity level. Don't just follow the bag. Every cat is an individual. Measure out their food for each meal. It's a simple step that makes a world of difference. Next, the type of food matters. Dry kibble is often high in carbohydrates. I recommend wet food, higher protein, and much higher moisture content. That helps hydration and makes cats feel fuller. Transitioning takes time and patience, but it's worth it. Now, exercise. We have to get our cats moving, engage their inner predator, hunt, catch, kill, eat, interactive playtime every single day. Use wand toys, make it flutter, skitter, and hide. Let your cat stalk, chase, and pounce. It's not just burning calories, it's mental stimulation. A bored cat is often an overeating cat. When your cat is more active, engaged, and comfortable, you'll know it's the best gift. Let's move on something happening right under our noses: dental disease. By 3 years old, most cats have dental issues. It's more than bad breath. Chronic silent pain. Imagine a constant toothache you can't tell anyone. The problem starts with plaque. Plaque hardens into tartar. Tartar causes gingivitis. You might see a red line on the gums. Untreated gingivitis becomes periodontitis. Infection goes below the gum line, destroying tissue and bone. Consequence: tooth loss. Consequence: abscesses. Consequence: systemic infections. How can you tell a cat is in pain? Bad breath, drooling, dropping food while eating, chewing on one side, reluctant to eat hard food, stopping eating, becoming head shy, pawing at the mouth, recoiling when you pet their face. Prevention starts at home. Gold standard: brushing. Use cat-specific toothpaste, never human paste. Start slowly. Let them lick toothpaste off your finger. Try a finger brush, or a soft bristled pet toothbrush. Even a few times a week helps. Other tools: dental diets. Dental treats with textured surfaces. These help, but aren't a substitute for brushing or cleanings. Regular vet checkups are essential. A few minutes each week plus vet visits adds quality years. Okay, let's talk about the creepy crawlies, fleas, ticks, worms. I know it's not a pleasant topic, but it's a critical one. These parasites aren't just a nuisance, they are a serious threat to your cat's health. And don't make the mistake of thinking your indoor-only cat is safe. Parasites can find their way into your home on your shoes, on your clothes, through an open window screen. No cat is completely immune without proper protection. Let's start with fleas. A single flea can quickly turn into a full-blown infestation. They feed on your cat's blood. For many cats, flea saliva causes flea allergy dermatitis, intense itching, frantic scratching, hair loss, scabby skin around the base of the tail and neck. It's a miserable experience for the cat. In severe cases, a heavy flea burden can lead to life-threatening anemia, especially in kittens or frail cats. And it doesn't stop there. Fleas are also vectors for other diseases and parasites. When a cat grooms and swallows a flea, they can get tapeworms. External problem becomes internal. You're fighting infestation on skin and in your home, and worms inside. Roundworms, hookworms. Kittens often get these from their mother. Adult cats can pick them up from contaminated environments like a dirty litter box, or from soil. Prevention is everything. Be proactive. Year-round, veterinarian-recommended parasite preventive is the most effective protection. Topical spot-on treatments, oral medications, stick with a vet-approved, cat-specific product. Being a parasite detective and a prevention champion is a core part of being a responsible cat guardian. We're now moving into a topic that is particularly relevant for those of us with senior cats, though it can affect cats of any age. I'm talking about chronic kidney disease, or CKD. This is one of the most common diagnoses in older felines, and it's something every cat parent needs to be aware of. The kidneys are incredible organs. They're responsible for filtering waste from the blood, regulating blood pressure, and maintaining hydration. When they start to fail, it has a domino effect on the entire body. The insidious nature of CKD is that the signs are often incredibly subtle in the early stages. A cat's kidneys have a huge amount of reserve capacity. They can lose up to 75% of function before any obvious symptoms appear. This is why it's often called a silent disease. By the time you notice something is wrong, the disease may already be quite advanced. This is what makes early detection so critical. So what are those early signs you need to be watching for? The two most common and earliest indicators are an increase in thirst and an increase in urination. You might notice your cat is spending more time at the water bowl, or that the litter box clumps are suddenly much larger or more frequent. This happens because the damaged kidneys can no longer concentrate urine effectively, so the cat loses more water and needs to drink more to compensate. It's a vicious cycle. While there is no cure for CKD, the goal of treatment is to slow the progression and manage symptoms to provide the best possible quality of life. The cornerstone of this management is hydration. This is another reason why a high-moisture, wet food diet is so beneficial, especially for senior cats. You can also encourage drinking by providing multiple water sources like a pet water fountain. This brings me to the most important prevention tip: regular veterinary screenings. Catching it in its earliest stages gives you the best chance to intervene and slow its progression, and give your beloved feline companion many more comfortable, happy years by your side. The last major health issue we're covering today is one that is closely linked to the first one we discussed. I'm talking about feline diabetes. It's becoming alarmingly common, largely due to the epidemic of obesity in our cats. Diabetes mellitus in cats is very similar to type 2 diabetes in humans. The cat's body either doesn't produce enough insulin, or its cells become resistant to insulin's effects. Insulin is the hormone that helps move sugar, or glucose, from the blood into the cells to be used for energy. When this process fails, glucose builds up in the bloodstream. Hyperglycemia. The cat's body is literally starving for energy at a cellular level, even if the cat is eating a lot. One classic sign is a ravenous appetite, but simultaneously losing weight. It's confusing and counterintuitive for many cat parents to witness. Other hallmark signs are very similar to kidney disease: a significant increase in thirst, and increased urination. The body tries to get rid of excess sugar by flushing it out through the urine. Sugar pulls water with it, leading to large volumes of urine, dehydration, and a powerful thirst to compensate. And the litter box is consistently soaked. Diabetes should be on your radar. The good news: feline diabetes is very manageable, and for many cats, it can even be put into remission. The key is a two-pronged approach: diet and insulin therapy. The goal is to stabilize blood sugar levels. Treatment almost always begins with insulin injections, which you will learn to give at home. It sounds daunting, but with practice it becomes a quick part of your daily routine. Dietary management is the other critical piece. The ideal diet is very low in carbohydrates and high in protein. This helps prevent sharp post-meal blood sugar spikes. That's why canned pâté-style wet food is usually recommended over dry kibble. For many cats, switching to a low-carb diet is the single most important factor in achieving remission. This brings us back to obesity. Maintaining a healthy, lean body weight prevents diabetes. By preventing obesity and watching for increased thirst and urination, You can protect your cat or catch diabetes early enough to manage it successfully. So there you have it. 5 of the most common health challenges our cats face. Obesity, dental disease, parasites, kidney disease, diabetes. The common thread here is that knowledge and proactive care can make all the difference. This video is a starting point, a way to empower you to be a more observant and informed guardian, but it is absolutely not a substitute for professional veterinary care. If you notice any of the signs we've talked about today, or if anything just seems off with your cat, please make that call to your veterinarian. They are your #1 partner in ensuring your cat's health. Early detection saves lives, period. I hope this information has been helpful and gives you the confidence to take charge of your cat's well-being. If you found value in this video, please give it a thumbs up and share your own experiences or questions in the comments below. I love hearing from you and building this community of dedicated cat people. And don't forget to subscribe to Trends News and hit that notification bell for more tips on how to help your cat live their best life. Thank you so much for watching and for caring so deeply about the cats in your life. Remember, every day you have with them is a gift. By being their health advocate, you're making sure you can enjoy as many of those precious days as possible. Until next time, keep calm and purr on.